Hello, hello, everyone, and welcome and good evening to this very exciting training about a product we've recently launched just amongst the social marketers called Elevate. My name is Margie Aliprandi, and this may well be one of the most exciting. And I know if you're jumping on right now, like information-packed trainings that we've had in a while. So I want to be sure that you're tagging everyone and bringing them in so that we can get you fully confident, get your questions answered, and make you very bold and effective at sharing this amazing product and the science that goes along with it. Real quick, about more than half of the bottles of Elevate is in the house, in the warehouse, and more than half, probably about 2/3 of the orders have shipped today. So that's really good news because our goal is to get this in your hands before the event. We're really excited to get some testimonials, to have you have a strong foundation and your own personal experience with the product coming into the event so that as we launch a few other products at the event and fully launch this one, Elevate to the world, that you are ready to capitalize on this upcoming season through the spring here, which is like one of the top seasons for growth and volume and team building in our profession. So with us tonight, I'm so excited that we have Dr. Lynn joining us again this evening. Her story has deeply moved me, and I find myself telling her story a lot. Dr. Lynn was voted top MD in Tucson. She has been in the medical profession as a doctor, family medicine doctor, for 25 years. She also has a deep, rich background, experience, and understanding of holistic and natural therapies. So she brings so much wisdom to the table. Most importantly, I was so moved by your story and your testimonial about your experience with your first Nueva experience with Nueva Body, and just so that people know a little bit about you before we dive into this very exciting product, Elevate. Love you to just share, if you could, a Cliff Note version of your story. Welcome, Dr.
Thank you so much. Thank you. So, for those who don't know my background, I have an autoimmune condition that a lot of women actually have, Hashimoto's thyroiditis. So I was diagnosed with that probably 15 years ago. And initially, it didn't really affect me too much. But as the years went on, I started having the brain fog. I started having, besides the cold extremities, the nerve issues, fatigue, mood issues, feeling kind of down, never seriously depressed, but just never really happy either.
Mm.
Really hard to find motivation. And another condition I had was a toxic type of chemical exposure injury. And so all of that combined just led me down a path where, I mean, I literally felt like I was aging so rapidly. I thought that I even had dementia at my lowest point, and I was scared because at that time I was only 47 at that time, and to think, oh my gosh, this is it. I'm not going to be able to continue practicing as a physician was just so scary. So that's when I really started digging into functional medicine, finding ways outside of the traditional medical community, ways that I could help myself. And so I started on hormones. I started doing a lot of different supplements. I started using lasers on my brain. I mean, you name it, I tried it. Um, and then I was introduced to Nueva, and it has changed my life. Um, Before I start, and just so you know, I measure a lot of objective data in my practice. So with all of my patients that come in, everyone gets a grip strength so that I can measure their longevity. I also do body composition testing where I'm measuring body fat, muscle mass, that type of thing. And so I also measure myself. And when I started doing this with my patients about 6 years ago, I had my baseline data, and I was never able to move the needle, no matter what I did, all the different exercise classes, weight training, that type of thing. It just, nothing really changed. And then I started on the Nueva Nitro, and I also started on Nueva Body, and I was blown away because within 3 weeks, I had gained 2 pounds of muscle. And within 5 to 6 weeks, my grip strength had switched from being someone that was at 70 years of age, and I'm 51 right now. So it was 70, and it went down to my appropriate age within 5 to 6 weeks. So I know that these products, they're doing something. They're increasing cellular energy. They're so different than anything else that I've tried before. And I'm just so grateful to know that I have something that's extending my longevity, that's giving me my mind back, my muscles back. It's just been so awesome.
I find it so profound because you did have everything at your fingertips, everything from a drug or, everything from a
Oh,
natural
yeah.
therapy
I've
standpoint.
spent
You had it
so much
all.
money, so much money trying to biohack this body, this brain. So to be able to do it at so easily with tablets and not have to do injections, and
Yep.
believe me, I've been researching peptides for years. Okay, I've got thousands of dollars of peptides in my refrigerator,
Mhm.
ones that you have to reconstitute with bacteriostatic water. And do you think that I've done any of that? No,
So
because
complicated, even for a doctor, even for a
I
doctor.
mean, just the thought of having to mix everything, knowing that, these products, when you mix it with water, you have to really watch the shelf life, and, having to inject every day. So to find something that I can just pop a pill once a day was amazing. And so I've been telling all my patients about it. They're embracing it. They love the fact that it's just a tablet, it's once a day, and it's so easy. And man, I'm really fired up to talk about Elevate because this is such a profound and beautiful formula. Initially, when I heard about it, I couldn't quite wrap my mind about why would they do tesofensine, dihexa, BPC 157. I couldn't figure out what exactly was going on there, but after having some time to try it myself and really thinking about where this comes in, when you're looking to restore your health, to rejuvenate your health, to redesign, repattern your health. I mean, it's just simply so amazing. So, um, yeah.
Amen to that. Very, very deliberately selected formula that is brilliant.
Yeah.
And I received some of this product at our event, our summit in Dallas, and tried it a little bit, much like Ashley does. I tried it and then I kind of put it away, and I was cycled off body at the time, but I had like pretty much a full bottle left. And I decided it was more important to get it in Dr. Lynn's hands. So a couple weeks back, I sent that to her. So she has real life experience now, not with just all of her research of these individual components, compounds, but she now has experiential. So let's bring up the slides if we could, Sean. And we'll kind of just start going through here a little bit. So elevate the science behind it. Um, let's see. Am I off camera? This. drop in the chat if you can see me, because I can't see me anymore. There we go. Okay, there we go. So thank you, thank you. There, we've got the slides up now. So, Dr. Lynn, let's start by having you share your experience, your testimonial of what you experienced when you started taking it. And then we'll dive a little deeper about how to integrate it with body and all of that in a minute. But just kind of high level, what was your experience with Elevate?
Sure. So when I received it, it was during the time that I was cycling off of body. And so it was a perfect time for me to just try this alone. I made sure that I did not even do nitro during that time. I just really wanted to experience what this was. And I will tell you, I was a little nervous because I've taken medications that can curb your appetite. In the past, several years ago, I did try some phentermine. If people, hopefully people know what that is. It's a kind of a stimulant, appetite suppressant that it really does work. It shuts off your appetite. But the thing that it did to me was that I had the worst insomnia, and I just felt so weird. So I couldn't take more than just one dose because I never slept that night. So I was really scared that the same thing would happen with this, which fortunately it did not. So I took one every day, and I definitely noticed, when the light bulb turns on and you just
Yes.
feel a little smarter and the words are coming. It's that kind of flowy type of state where you sound really smart and you're going, oh my gosh, I can't believe I just said that. That's so amazing. So I did that for a week, and then it was time for me to get back on body. So I stopped it for a week. I let myself get back on body, and I wanted to see how both peptides work together. So what I did was I took the body peptide in the morning, and then fairly soon afterwards, I took the Elevate, and I couldn't, personally for me, I could not tell one from the other. So taking the Elevate, it didn't have the same impact taking it with body as it did just taking it alone. That being said, I did that for 2 days, and then I had another 5 days left. So what I ended up doing was taking the body in the morning and then taking Elevate in the early afternoon. Again, just wanted to see what it would do. And I did notice when you take it away from body that you can tell the effects from the dihexa, just that kind of mind turning on type of thing. And I didn't have any problems falling asleep, but I will say that my internal alarm woke me up about an hour earlier than I normally wake up. And, I didn't have as that many days on Elevate doing it that way. So I can't tell people if, if that's going to happen to them, if it's going to impact their sleep in any way. But again, no problems falling asleep, just sleep duration just wasn't as long. And that was with,
And that's with you taking it fairly late in the day. And, sorry to cut you off there, but just to keep things moving along, you were very deliberate about that choice too, as I recall,
yep,
because your Achilles heel is that late night snacking and that those craving of carbs and sugar and all of the things in the late night. And so by taking it at 1 o'clock in the afternoon, and incidentally, I haven't had one person yet say that it messed with their sleep. Um, so that, and even taking it that late in the day, but spacing it out from body gave you the benefits of body. And also, did it help with the late night snacking?
oh yeah, definitely. I was on a little bit when I was off a body. And it was around the holidays. I got into the habit of eating jelly beans. I love jelly beans. Late at night, just craving jelly beans, especially after a stressful day in the office. And did not crave those jelly beans. So it definitely reduced my evening cravings. And yeah, so that was really nice to see.
Fantastic. That's fantastic. Okay, so let's dive in a little bit into the specific ingredients in this amazing product, Elevate. Next slide, please. So first of all, we have, yep, next slide is fine. Less mental noise. Let's go to, yes, tesofensine. So when we're talking about how this works and some simple things that will help you differentiate it from body. I think most of the questions that we're getting, and I did a live in social retail that answered these questions, but you're going to really get the in-depth answers tonight with Dr. Lynn and from Tina Margaris as she shares her testimonial and her approach to this. But because these work, because body and elevate work with different mechanisms, they actually can work beautifully together. Now, whether that is financially tenable is another story, but because you're working with the metabolic and energetic pathways, think about it this way. When you're taking body, it's working from the body to the brain, right? When you're taking Elevate, it's working with the neurotransmitters, with serotonin, dopamine, and norepinephrine. That was always hard for me to say. You're working with the neurotransmitters, and so you're working brain to body, different pathways entirely. So this is going to support balanced signaling that will increase focus and mental clarity. It supports steady mental energy, and it's not a stimulant. I've had so many people that maybe even, similar to you, Dr. Lynn, who have been concerned that something stimulatory could keep them awake or whatever. Just the reminder that it's not a stimulant, so you won't have those peaks and crashes. In fact, we'll get into this later, but actually, tesofensine has a 8 to 10 day half-life, and we'll talk about that, how that helps you gradually to wean off, so it's a gradual ramp down that just happens naturally. It definitely supports food-related distractions, and it keeps your internal communication more orderly and organized. What do you want to add to that? Anything else you want to add to tesofensine as an ingredient?
Yes, so how I think about tesofensine is a compound, and again, it's not a peptide itself. It's a compound that crosses the blood-brain barrier very easily. And what it does is it increases serotonin, norepinephrine, and dopamine, which are so important for healthy brain function when you have optimal levels of all three. Um, Typically, when you think about these type of neurotransmitters in people that are on antidepressants that specifically raise serotonin or specifically raise serotonin and norepinephrine, we think about those type of medications that help support mood, that reduce depression, that can also help lower anxiety, just make you feel calmer. And so that's the wonderful thing about tesofensine. It can help with mood support. But what's so interesting about this compound is that it raises dopamine. We really, I mean, in the psychiatric world, there are not a lot of medication, prescription drugs that can raise dopamine. And so um, people still notice when they're on antidepressants, a big thing is that they still don't have motivation and drive. Or even if they feel happy, they're not having any symptoms of depression, they can still crave food. They can still, you know, not feel satisfied after eating. And so, part of the questions that you want to ask yourself if Elevate is going to be working for you. Um, if you think about food, even when you're not physically hungry, I had a patient today who said, my husband, he'll eat a large dinner and he still wants to eat. So that's the type of thing. If you don't have enough dopamine, supported dopamine, you just feel hungry all the time. You crave something sweet. Even when you're satisfied, your hunger feels urgent rather than gradual. Stress really increases your hunger. You snack without realizing it. Night eating is common. And the other big thing is that when your neurotransmitters, when they're not in balance, your brain just feels kind of inflamed. It rarely feels calm. You don't have that peace, that flow. So these neurotransmitters, when you get to that state, that flow state, not only are you just not hungry anymore because you don't have to reward your brain with food and sugar and all that, but you just feel like you're in a much better headspace. And um, the neat thing about tesofensine, it has been very widely studied. So when
Yeah.
they were looking at tesofensine, it was initially the drug companies were looking at it as medication to help treat Parkinson's and Alzheimer's. Unfortunately, they didn't get the data that they needed to get for the objective data for those types of diseases. But what they did find is that tesofensine greatly reduce hunger. And the dose at which Elevate is at, the 0.25 milligrams of tesofensine, in clinical studies, they showed that it caused a weight loss of about 6%, which is huge. Okay. A 6% weight loss is big. And then if you go up on the dose from a 0.25 to a zero point 0.5 milligram dose, that pretty much doubles. Okay, so you go from a 6% weight loss up to a 11 to 12% weight loss. And so I guess that kind of brings up when we talk about dosing, how should people dose? And I don't know, Margie, do you want to talk
Yeah,
about
well,
that
let's
right
let's get
now
into
or?
let's get into that a little bit later when we're talking about combining
Mhm.
these. Let's just quickly give the framework of the ingredients. So brilliant. I learned so much listening to you. Um, so to just kind of reiterate, tesofensine will make the communication, the messaging, right? It makes the messaging in with these neurotransmitters, it makes the messaging stronger and last longer. So and learning about this impact on dopamine is, truly magnificent, especially hearing how hard that is to achieve really in any other way. I mean, it's magnificent. Let's move to the next one. Next ingredient is dihexa. And if you, because this it's a lot to try to learn all these things. Um, I've been reducing these to one word. Like if you were to look at the role that tesofensine plays, it really creates clarity. Obviously, it mitigates food noise and all of those things, but it's the orderly thinking. It creates clarity. It creates spaciousness. And then dihexa will support the even support the creation of new neurons, right? So now you've got the space. Dihexa comes in and supports infrastructure, and so I like the word capacity for dihexa. Capacity supports organized thinking, cognitive adaptability, learning capacity for more demanding days, memory related pathways, encouraging long-term cognitive resilience. And I'll pass it to you now on the dihexa. See what you want to add on that one, Dr. Lynn.
Yeah, so the dihexa, when I think about the awesomeness of what Elevate is, um, the tesofensine, what it does, it helps to remove everything that's in your path. And obviously, I mean, we're talking about a product that can help people lose weight. And so because it reduces your appetite and those cravings, the, inflamed brain type of cravings, you're able to remove things that are, inflammatory. So for a lot of people, it's going to be processed foods and sugars and stress eating and that type of thing. But the neurotransmitters of from the tesofensine, it helps to restore the brain. And then we have dihexa. And when I think about dihexa, I think about repatterning. Um, Oftentimes, the reason why our lives don't change is because we have been so patterned, even before we were born, and certainly as children, what people tell us, what our parents teach us, going through school, the habits that we learn, we develop patterns over time that last until we're very, very old, and they're
Yes.
so hard to break these patterns. The words that we say to ourselves, the things that we do, it's all because of patterns. And so with dihexa, because you're able to grow all these neural pathways, the synapses, um, it's like, I guess when I think about it, it's kind of like Medusa with all of her snakes everywhere. You're getting all this information, your learning capacity goes up. You're able to benefit, to use dihexa as another way to um, to change your patterns, to be able to redesign your life in the way that you need it to be. Because, the worst thing is doing the same thing day after day after day, thinking that you're going to change your outcome. This allows us to think differently for for us to take in our environment and have that wonderful neurotransmitter type of environment where we don't have to worry about the stress and the depression and the anxiety, where we have motivation and energy and everything's flowing. And then you have the dihexa that allows you to learn new things. And so with Elevate, and I love that name, by the way,
Amen.
yeah, we're able to, you know, use it and, you know, take this opportunity, learn new things, do new patterns, change up your day, and it's going to stick. And so it really gives us the opportunity to make huge changes in our life. And so I'm just so excited to see, once I get a full bottle in and
Yes.
everyone
Yes.
says, the amazing things that this community can do and learn and be and change. And so, yeah, definitely the Elevate, again, when I think about it, it's removing, it's restoring, it's repatterning. It's just amazing.
Yes, yes, yes. Next slide, Sean. BPC 157. This is one that we are already familiar with, and it supports and regeneration and tissue repair and tissue resilience. In fact, if we say clarity for tesofensine and capacity for dihexa. And I love how you explain that. Just the sense that there are new possibilities because new neural connections can occur. Then here sits BPC 157
Mm.
as the stabilizing, healing, regenerative, um, supportive. And I know you're especially excited about the way that it it supports gut brain balance. So let me turn it to you and have you talk a little bit about the role that BPC 157 is playing here.
Yeah, so this was brilliant to put BPC 157 into the mix because for those, and I know there's so many people out there, holistic people out there, they know that it all begins in the gut. Health begins in the gut. And so I just love this idea that the BPC 157, it's really helping to reduce inflammation in the body, specifically with the gut. And because that gut brain connection, this is so important important to be able to support that gut-brain axis, and because you have tesofensine that's allowing you to just stop, make good choices with your diet where you're not eating the sugar or the gluten or, processed foods, that type of thing. You're eating a higher protein diet, healthy carbs. You're really supporting gut health. You're really supporting the bacterial balance in your gut. And so it just works so beautifully to have that in there, to work with the diet and also inflammation.
Yes, thank you, thank you. Next slide, please. So this is designed as an entire system. You can see now as you hear a little bit more from Dr. Lynn and you learn a little bit more about each of the individual compounds, how they work together so brilliantly. There's such impeccable design in bringing these together in the amounts that they are, especially when you look at the entire product lineup that we have here. So you've got tesofensine that's supporting mental bandwidth, reducing food noise. You've got dihexa that supports smoother cognitive flow and adaptability, right? The ability to create new patterns. While you were talking, Dr. Lynn, I just thought of grooves in a record. For those who even remember what those were and how deeply those lines can get just ingrained and repetitive. And so the chance to create new neural interaction, I mean, just so dihexa is really important piece. And then, of course, BPC 157, supporting the resilience and recovery under demand. Next slide. So all in all, mental flow, internal noise gets reduced. It supports the reduction in internal noise. It supports resilience under demand and long-term system stability because of, like Dr. Lynn said, the gut-brain connection and how brilliantly the formula is put together. So I want to, now next slide, please. We've got another guest that I'm really excited for you to hear from, and then we're going to come back and answer some of the frequently asked questions. What I'm going to encourage you to do at that point is text me if when we're getting done, we haven't answered your question. But believe me, we've got a lot of these bases already covered. I'd like to now, let's go ahead and pull the slides down, Sean, and let's bring in Tina Margaris, who is going to share her testimonial and her experience of Elevate with us. And we can, there we go. So Tina, evidently, I'm the drug pusher here. I send mine off to Dr. Lynn, and at the event, I had 2 bottles. And what did I do?
You gave me the other one.
That's it. That's it. So share
Thank
your.
you for having me on, Margie. And it
Yeah.
was so interesting to hear everything Dr. Lynn had to say. Thank you so much for your expertise. It's always nice to be able to hear from like a medical health caregiver, a practitioner that's in the field, currently working, and also like adapting and encouraging integrative health inside a general practice is so amazing to hear. I think it's totally the future. As somebody who was a former healthcare provider, it's super exciting to see this happening in regular
Yeah.
medicine.
Yes.
Yeah, super, super.
So yeah, share your experience.
Well, I decided that I was going to finish. You gave it to me in Dallas at the end of October, and I waited to finish my month with utilizing the body peptide because I wanted to see what my experience would be utilizing it alone. Now, I will let you know that I did utilize 2 tablets a day, which was recommended at the beginning when we were first testing everything out. So I utilized 2 tablets a day. I took them both together first thing in the morning, just like I would take my body. I also continued to utilize the nitro. From the day I received my first bag of nitro, I haven't missed at all because I just
Same.
feel that nitric oxide is just vital to everything that happens for us. And because we're losing 50% of it after the age of 40, I don't want to miss out. So
I'm with you.
the accumulation of that nitric oxide is so important. Some of the things that I felt. Well, I did feel clarity, focus, all of those things, but I will also let you know that I consider myself a fairly optimized for somebody that's almost 62. And I had been ramping up and making decisions for myself in regards to being an elite masters athlete. I've always been an athlete. I was a national athlete as I was young. And I thought, wow, what can I do now in these, like, you start counting the years. It's crazy of how long are you going to be super efficient? How long are you going to be powerful? How long are you going to be strong? How long can you sustain lots of training hours or double days of training? And I made the decision that I was going to do that in 2026. So being able to utilize the Elevate and that, like having my experience with body, utilizing the Elevate. What was amazing about the Elevate is that I don't have food noise because I do prioritize protein. I do eat 3 meals a day. I do follow a 4-4-12. So I didn't have those sorts of things. Like I said, I'm optimized, but I was leaner and stronger when I was utilizing this. So now I have that comparison between the body and having that really great, like, cellular strength. Like I really feel that when I'm utilizing the body. But this, I felt otherworldly. I don't know how to explain it. And I don't want to be some, sound woo woo, but that is actually how I felt. And so I'm really looking forward to getting my Elevate, which I'm so excited that has been shipped, because I think that what I will do, and this is my personal preference, and other people will have other preferences. I will, as we're cycling, and I know you're going to talk about that later, I will do 2 months of Elevate. And on my month off, I will do 1 month of body. And that is my decision for myself. Some people may want to do it the other way around, right? But I do think, like I say this every day, I say it to people I'm around, that I feel that peptides for the lay person are the future.
Amen.
And we have the obligation as to be educators of this, because 2 years from now, there will be many, many supplements that will be pushed by the wayside
Yes.
because we have the ability to utilize therapeutic peptides instead. There will always be some staples, right? But a lot of things will be pushed by the wayside. And we are the people, if we are now in that education phase of teaching people, when it comes time for them to take the step to utilize peptides, therapeutic peptides, however you want to call them, they're going to remember us.
Yeah.
We were the first people teaching them. They're going to be reaching to us because they will know that we're there for them and we're the most educated on it. So I'm super excited. My personal experience was, like I said, otherworldly. I can't express enough excitement that I am going to be 62 and I am functioning like an elite athlete. That's miraculous to me,
It
right?
is
I'm not like dwindling down. I'm ramping up
up.
because of
Amen.
peptides,
Amen.
and that is super exciting.
What's so fascinating about your story, and each story, reveals a little bit more about the impact that Elevate can have, that these products
Mhm.
can have together, but the fact that you didn't have food noise and you got still astounding results. Can you please
I
just
had
share that
abs,
you
and
actually
I
got
did.
abs? You got
I was starting to see my abdominal muscles, and I was like, okay, I didn't ask for this, but this is amazing. Like those were that was my thought.
and like strong, and the mental capacity, all of the things. Yeah, it's fascinating. And I am also a strong believer, every time I've talked about any of these products and using them together, that you try the Elevate on its own. To me, the nitros are non-negotiable as well, but
Mhm,
that you try it so you really know what you're getting from it. And
mhm.
you will be so much stronger for your own personal decision making, but also as someone who's going to recommend them as you have that experience to draw. And so grateful that you brought that point out. I'm so grateful to have you. I can't wait to see those abs, girl.
I'm
In
working on them.
in Orlando. Let's see.
Bring me more Elevate.
Well, thank you. Thank you so much. I'm going to, Sean, right now, I'm going to pop to the last slide. If you want to just bring that last slide up real quick. And let me just tell you how you can get your hands on some. Next slide, if you haven't already. And you guys, we're very early in the process with this product. But I do know a lot of people that are excited to be able to get this in the signature set, both because the price point gets the individual bottles down to about $150. You get your free nitro, and I've got team members that are going together, or team members that just are going to be helping sample. We're going to talk in just a minute. They're going to be sampling out some of the product. But we're going to talk about the questions that you're going to want to ask here to make sure that somebody's a good candidate for the product. But first of all, like, I am all about this signature set. This is just incredible. The savings that you get, and for $449.99 to be able to get 3 of these plus the free nitro, literally $100 off. And guys, you get 550 points. So in a month, when we're preparing for an event and people are, looking to cross the stage at a bigger rank, this is the precious. This is it. So be sure to grab yours. I got one signature set, then I went back in and got another signature set, and I'm just excited to get this product in people's hands. So encourage you to grab some or grab more, and take advantage of this signature set promotion while we've got it going on. Of course, free shipping. All right, let's pull the slides down. Let's bring Dr. Lynn back in, and we're going to go through a few questions. First of all, Dr. Lynn, who should ask their physician, or who should consult with their physician before taking this product, or work in tandem with their physician? Not that they can't take it if they're on antidepressants, but it should be, done with oversight of a physician, right? Anyway, just dive into this. Who should consult their physician before taking this product?
Well, first off, obviously, if you're pregnant, I probably wouldn't recommend this product. People who are already on antidepressants, you really should speak to your physician about the fact that you're going to be on something that can raise serotonin, norepinephrine, and dopamine, so that they're aware. There could be some interaction there. People who are on stimulants already, so someone who might be on Ritalin, Adderall, you're probably not going to want to add this Elevate on, or maybe do it cautiously, again, with the guidance of your physician. Uh, they found in clinical studies that tesofensine, it can raise blood pressure, not a whole lot, maybe 1 to 3 points. So your systolic blood pressure might go up by 1 to 3 points on average. What they found is that the higher the dose, the more it affected blood pressure. So at the dose that we have our Elevate at, the 0.25 milligram tesofensine, usually you don't see much with blood pressure, but once you get up to 1 milligram, that's when you're going to see a little bit more. All 3 doses, when they were looking at the studies, a 0.25, a 0.5, and the 1 milligram, all 3 doses did raise heart rate. So that is something that I kind of noticed the first few days, where my heart seemed to be beating a little bit more faster, a little bit stronger. So it may raise your heart rate by about 7 to 8 points, where it probably isn't a big deal for most people. But if you're already somebody who has atrial fibrillation, tachycardia, high heart rate, or if having, if you're very aware of your heart rate and it makes you anxious and it goes up a little bit more, you may feel, a little strange or more anxious if you're really feeling your heart. So I do want people to be aware of that. And then the other thing to note is that because of its very long half-life, I do recommend that everyone just go ahead and start with 1 tablet per day
Yes. Yes.
because it does build up on itself. What you're feeling on day 1 or 2, just that kind of mental clarity that's improving, that's probably more the dihexa that's doing that. And then as you start taking it, more days, you're going to see enhanced effects from the tesofensine, the serotonin, dopamine, norepinephrine starting to go up. And so you might not think it's doing anything for you the first few days, but then after being on it for a week, you might say, wow, okay, 1 tablet is enough. So if you are going to go up to 2 pills per day because you want to see more of the food noise go down and you'd like to see the weight loss, more robust weight loss, at least wait a week and then go up to 2 per day. Now, if you're going to split it 1 twice a day, just be careful because that the product can affect your sleep in some individuals. So the biggest side effects that we see from this: dry mouth, insomnia, nausea, headache, constipation, diarrhea. Those are some things that are really real. That's what they saw in clinical studies. But interestingly, there were very few people who dropped out of the study because of the side effects. So, um, most people.
Manageable, like manageable. And if you are someone that has a little bit of a sensitive stomach, which incidentally I am, and I didn't have any difficulty taking it on an empty stomach, but you can take it on a lightly fed stomach as well. And then would you say there's an adaptability, which is why start with one. Let the cumulative benefit of one really sink in, saturate before upping the dose, and definitely get a sense of what this product does on its own. But is there an adaptability? It seems like in the things I've read that you may have some like the things you mentioned, your heart might feel like it's beating a little faster or whatever. So
So
yeah,
that eventually, you probably will get
level
used
out.
to, you'll level out. What's interesting too about tesofensine is that you may feel after a while, if you decide to be on it for longer, you may find that it doesn't stop your cravings as much as it used to, but they found in the studies that even if your appetite wasn't as suppressed, you did not see the rebound weight gain. So that I thought was interesting. So there may be a little bit of a um, thermogenic effect. Maybe it increases your metabolism a little bit. Calorie expenditure, especially at night, is what I read. So that was interesting. And then the other thing is if you are taking this, let's say, more than a month and you decide to get off of it, you really should not just stop it abruptly. I mean, the nice thing is that because it has such a long half-life, most people won't go into, a withdrawal right away. And maybe most people would do fine because it gradually gets out of your system. But for people that are used to having higher levels, they get used to having higher levels of serotonin, norepinephrine, and dopamine, and then all of a sudden it's not, as high. Um, People may notice that they're more irritable, that they're more tired, that their mood isn't as good as when they were on Elevate. So it's just something to be aware of. Okay.
Yeah, and the fact that it's got that half-life built in, like on day 8, you still have 50% the remaining day 16, 25%, day 24, you have 12.5%, day 32, you have 6% remaining. So you kind of have this gradual wean, which if you are cycling with body, kind of gives you that carry over. And this one great recommendation, and we're going to talk about a few different ones here. Even going to bring Tina back in a minute just to talk about what are some of the cadences of taking this that could be highly recommended, and where basically they're both body and this are 2 months on, 1 month off. If you start with Nueva Body and you're getting that metabolic pathways and all of that foundational stuff, the cellular level stuff handled, and then you add this in the off month, that is one way that it works brilliantly. And then you took Elevate on its own and then gradually moved into taking it along with body. And I think there are a number of people that are successfully doing that. So let's talk about ways to use this with the other products. You had a great idea that you shared with me the other day about maybe starting them with Elevate, depending on what their needs and their issues are. And let me just set this up real fast, and then I'll have Dr. Lynn share this idea because I think it's a brilliant one as well. But when you're talking to someone, you can ask the question, in your weight loss, like if weight loss is what they're targeting, right? If in your weight loss journey, why have the other things you've tried not worked? And if they throw in, well, because I just can't stop eating my carbs, or my late night cravings, or I just need my sugar, to start them with Elevate, as long as they're not on, antidepressants, or they don't have a heart condition, then to start them with Elevate. If they don't mention anything about the food noise, then maybe you start them with body and lead them to Elevate. So share just your idea about the 20-day thing that you mentioned.
So what I've created is kind of like a quiz where try to figure out what is really impacting someone's health goals. And for a lot of people, if it's more of a, they can't even think, they're so stressed out. All they think about is food all day long. They're not going to be able to have that low inflammatory environment that you need to really start to heal. And so I would recommend that you start with Elevate first, just to remove all the quote toxins.
Roadblocks.
Yep,
Yeah.
roadblocks, the food noise, the bad stuff, processed foods, that type of thing, sugar. And again, my recommendation would be start with 1 a day for a week, and then you can increase it to 2 a day. And then if someone feels ready, their mind is clear, everything just feels like they're settled, they've started making changes in their diet, they're starting to, move more, then at that point you could transition without continuing on with Elevate. You could transition into body at that point if it feels like they're ready to do that. But some people, they still need the support of Elevate before they go into body. Now, if you have somebody that they don't have issues with food noise, they're barely eating, because I have a lot of those patients
Yeah.
where
Yeah.
they're over the age of 60, they're not moving, they're not exercising, they're tired all the time, they're complaining of brain fog, and it's not like they're eating terribly. Those people, I start on nitro and body. So it's very different how you start. And I was really thinking about the utilization of these tablets, how easy they are to dose. And I was thinking how awesome of a tool these can be for someone who's a health coach, a physical trainer, people who have clients, some type of wellness practice where they don't have the ability to prescribe injectable peptides. this becomes a really nice way where they can do everything that maybe a prescriber such as myself, I prescribe injectable peptides and other things, but if you don't have that ability, it's so nice to be able to still coach your clients, be there for them, help guide them versus, right now there's so many programs with the hims and hers and rows and that type of thing where
Yeah.
you're handing off your clients to someone else to manage the medication and with the injectables and that type of thing, which I personally, I don't like it when my own patients are doing that.
Yeah.
I'd rather be managing them myself and supporting them myself. So if anyone knows of a wellness coach, trainer, that type of thing, who would love to be able to bring this into their practice with the coaching and then having these tools to help curb the cravings and the food noise, and then also empower them to change their habits and just change the ways that they've been doing things. I think that these could be really, really good with a holistic type of program.
I love it. I love it. Let's talk about the importance of the lifestyle things. How important is it to make sure you're getting your sleep, to drink water, eat high protein, exercise, move the body? Like, why is that even increasingly important if you are going to supercharge your body with these performance products that will up level you?
Right. So, again, we talked about the importance of the gut, and your gut bacteria, they're what's helping you make these neurotransmitters. And so you can, even with the Elevate, trying to raise your serotonin, norepinephrine, dopamine, unless you have the building blocks to make them, which is uh, eating an adequate amount of protein. The elevate's not going to work as well as it could. So you have to eat the right type of diet that supports these these peptide products. You want to make sure that you are getting at least 30 grams of protein per meal. So that's, just the basic how much protein you need. And then the other thing that I tell my patients, I like to see 1.6 grams of protein per kilo that they weigh. Okay, so you take your weight in pounds divided by 2.2, and then you times it 1.6. If you have someone who's very, very active, then I might even do 2 grams per kilo. Okay. And then the other thing that you're going to want to make sure that you do is get enough fiber. So I like to recommend 30 grams of fiber. Fiber is wonderful. It helps to feed the healthy bacteria in the gut. And speaking of bacteria in the gut, I also recommend to my patients that they should be doing fermented foods, ideally 1 to 3 times per day. So some simple things would be kimchi, uh, you could do sauerkraut. You can do, uh, I'm just kind of blanking, kefir. Those are some of the fermented type of foods, and it's really easy to incorporate into your diet. And I've noticed instead of my jelly beans, I'm eating sauerkraut. So in the
Oh,
evening, that cuts the appetite,
it's true.
works really well. And so you're getting the good gut bacteria, you're feeding the bacteria with the fiber, and we have some amazing products in our with the Nueva products with the Snow Slim. It has prebiotics and fiber, and we see that too with the Snow Collagen that also has prebiotics with the chicory roots. So um, that's really good. And then movement, of course. So 30 minutes
Yes.
of some type of movement is important. So for me, I tell my patients it's a 30-30-33 type.
Yep, yep, yep.
You
And
definitely
and
want
do
it.
that, do
Yes,
that in your 4-4-12.
right,
And
right. So you want to get people need guidelines.
yep.
They like numbers, and so if you can give them something really easy to focus on, it's going to just help their outcome, their results.
And I love the conversation about simple cycling, right? Let me ask you a couple of questions. First of all, to clarify, if somebody is taking antidepressants or, something for clarity, Adderall or whatever, doesn't mean they can't. They just need supervision to make sure, you know, like we're not positioning this as a track to get off, though yeah, I'll give you an example. With our nitro, if somebody's on blood thinners and this is going to expand the vessel virtually 100% in 45 minutes, so you're getting more blood flow. If somebody's on blood thinners, not that they can't,
Blood pressure medication, right?
or blood pressure medication, right? Like they need to be monitored, but it doesn't mean they can't. And in time, they may even be able to forego the medications. This is not our job to tell them that, but in tandem with a physician, they can. Let's talk about how this works with GLP-1s. Once again, very interesting because they work with different mechanisms where the GLP-1s are dealing primarily with emptying the gut and all of those things. This is dealing with the brain, and so they're different. I'll let you speak to. Can they be complementary? What are your thoughts on that?
Yeah, so if someone's on a GLP-1 and they've reached kind of a plateau in their weight loss, and they're not really noticing that the GLP-1 is helping with the food noise, you certainly can add Elevate to that. I know right now it's really popular for people to be microdosing the GLP-1s, which, clinically, studies don't show that they help you lose weight, but I mean, I'm sure some people do notice it. But if they're microdosing for other reasons, not for weight loss, and they're kind of upset that they're not losing weight, I mean, these are the perfect people that adding Elevate would help them reach their goals.
Yeah, yes. Agreed. Um, let's see. Let's bring Tina back in. I know that we're at the top of the hour, and I just was checking my messenger to see if anyone has any other questions.
Yeah, and I know there was a question about thyroid medication. I take thyroid medication,
Oh,
and
yeah,
so
yeah.
I have not seen it affect none of the products. I haven't seen them affect my thyroid hormone levels. If you're going to do it correctly, though, I mean, you probably should take it apart, any of these products apart from your thyroid hormone.
Couple
Personally,
hours.
and I'm not telling you should do this. Personally, I just take my body peptide with my Armor thyroid in the morning together because it just works for me. But it is important if you do that, you want to make sure that in 3 to 4 weeks, you recheck your thyroid levels, the TSH, T4, T3, just to make sure that there's no interaction. But personally, I haven't seen anything.
Awesome. I'm going to see for Elevate. What if someone does not need to lose weight, but they want the cognitive benefits?
Yeah.
100%, right? They're there. You just have to be mindful that you eat because you will feel more satiated, and the food noise will, if there ever was any, will be gone. You'll have less tendency to eat. You need to be conscious that you're eating.
And in the studies, it was interesting that tesofensine did not affect the normal weight animals as it did the heavier obese ones. And so if you have more weight to lose, you're going to see, much more of that weight loss than someone who's already a normal weight. If you don't have that much fat on you, you're not going to see as much weight loss. So I don't think we need to worry about people all of a sudden
Wasting away because
wasting
yeah,
away. But
yeah.
I mean, you definitely want to be mindful of your dosing. If you're already thin, you probably don't want to take two Elevate per day. And you want to follow those rules about eating enough protein, getting enough calories, and that type of thing.
Yep.
Yeah, I mean, I didn't
Jump in, Tina.
and I do not need to lose any weight, at all. because I think being strong is more important,
Yes.
sort of thing. So and like I said, yes, I was like, whoa, I think I can see my abs, but it was an added bonus. It wasn't,
It
anything
wasn't
like
a
that. And
target.
I don't step on the scale at all. I just measure by how I feel. And so, after Christmas, I'm a little fluffy. And the best part about being somebody who really prioritizes, regardless of whatever supplementation you're using, you cannot let go of the pillars of hydration, the pillars of nutrition, where you're prioritizing protein, especially in midlife, right? And the pillars of movement.
Yeah.
So I also feel that these peptides are so amazing, but they are another tool. They're
Tools.
another pillar we can add to that set of three that I'm very, very passionate about, especially for midlife women, because so many people, like you said, Dr. Lynn, do not eat enough,
Yeah.
right? And teaching people how to um, eat whole foods, eat real food, don't eat boxed food. Your life will change just from that. From that, you're going to lose so much inflammation, staying away from seed oils, all those sorts of things. And then being able to replenish what is depleted as we reach midlife and go through that transition of perimenopause and menopause and postmenopause. And of course, men are going through a transition too, as well, right? In regards to hormonal health. So I think what's super important is that we look at these peptides as like the ultimate tool, because up until now we've just utilized, vitamins. You're choosing your B12. I mean, D is a super important vitamin. It's considered a hormone. It's, nowadays in medicine, because it's so important. And magnesium so important, collagen important, but there's a lot of things that are happening that people are utilizing that we can take over with peptides.
I just looked in the chat to see if there are any questions popping up, and they're going, preach it, Tina.
Yeah.
Um,
It's
Honestly,
true.
we really could go on and on, but I have already shared how I'm
Mhm.
going to vet the questions I'm going to ask to determine what's the best path. How are you, Tina, going to determine whether you start someone with Elevate or you start someone with Body?
I think the most important thing is to obviously, you should say, if you're taking any sort of prescription medication, it's very important to run that past your healthcare provider, right? Nobody as a social marketer should be determining what people should be utilizing as far as supplementation when they're using prescription medication. But I will say that we know, and we've already been informed, and you've taught us, and Dr. Lynn has taught us so much tonight, that there are certain medications that we really need to take off the
An eye
table.
out for, yeah.
That's right. And so I'm going to be asking, especially my menopause community, because there's 64,000 women in there, and a lot of them have been prescribed antidepressants, right? I mean, it's one of the common things that happens when you go to your doctor and you're feeling so crappy, you don't really know what's happening to you. And that's one of the things I will definitely say, if you want to utilize the Elevate, you're going to have to run this by your doctor. But I can recommend the Body in regards to cellular health and increasing the RNAD, blocking the NNMT, being able to, restore some of our fat metabolism, hold and build lean muscle. I feel safe doing that,
Yes.
right?
It changes the
And
way that your
confident. I shouldn't
body.
say, I feel confident doing that.
Mhm.
So I love the fact that we have the two. For my more experienced people in my community that are already utilizing Body and loving it and have no other health issues, or they've been traveling this really great journey, I'm going to recommend to them that they, on their month off, try the Elevate, right? Then
Yeah.
they can determine which one they want to choose. And if they want to take both, they can. But I mean, that person's going to have a nice a nice
Bionic.
supplement budget. I don't know,
And a
but
good budget. Yeah.
listen, peptides are expensive, and once the real world understands that our peptides aren't expensive,
No, they're not.
all peptides, people can go to Walgreens and buy a vitamin for $14.99. So when you're introducing them to something that's so far advanced, as far as, like I said, it's performance and regenerative wellness technology is what we are sharing with the world, they're going to realize it in a year.
Yeah,
I'm
yeah,
convinced. So I'm not
yeah,
worried about it. I'm
yeah.
just going to keep teaching people about it.
Yes, 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 same. We've got the gold, you guys, with the products that we already have, the products we've already brought to market, 3 that you're going to be learning about in Orlando, and this product Elevate, it's game changing. It is genuinely a beast of a product, like just um going to have such incredible impact for so many people. And you've got it, and if you haven't experienced it yet, within days you're going to be experiencing it and having your own testimonial. And for someone that is, I'd love to get your take on this real quick, Dr. Lynn. So I've kind of recommended that if somebody's gone through their first cycle of body, they've really accomplished an important foundational thing. If they're, say, a month into their second cycle, they cycled off, maybe they did beauty, maybe they do beauty all the time anyway, and they're a month into their new cycle with body. Would it work to just pause on body? Because we have a good foundation now for a couple of days to be able to try the Elevate and to jumpstart. How would you recommend that kind of cycling?
Yeah, so I know everyone's going to be receiving their Elevate, and they're in different, um, parts of their cycling on or off. And so I think that it'd be a really good idea just to get off the body for at least a week and just try Elevate on its own, just to really know what it does for you. And then for those people who might not want to take something every single day. Again, going back to the long half-life, I do see this as something that people could do for maybe 1 to 3 weeks at a time, just cycling in and out using these products, because it takes a while to ramp up and it takes a while for it to, ramp down. So even if you did one a day for a week, then maybe 2 a day for the next week, and then one a day for the third week. I think that would also be a nice way to cycle it. I mean, people will just have to kind of play with this. It's the nice thing is that the abuse potential is there. There's no abuse potential. Okay, it's not a stimulant. It's something that I feel we
That
could
reminder.
use. Yeah, just if you're having some down days and you need to get motivated and you want to, change your patterns, change your life, it may be something that you do for, a week at a time, 2 weeks at a time. So that's the beauty of all these products, is that you're in control. You know what's best for yourself. And I find my patients, once they start learning about how their body works, once they start to develop intuition about what works best for them for healing, they really take control of their lives. And those are the ones who are the most successful. And they're just living amazing lives because they feel like they're in control. And I just think the Nueva products, it puts the power in your own hands. You're not looking at a physician to help guide you. Although, I do think that
Although you
people
are a
need,
physician.
yeah, people need health coaches. People need someone to kind of oversee. That's why, you have your counselors and psychologists and that type of thing. Parents, we need someone else to help us stay accountable. So, but you'll figure it out. I think the more you experience, elevate, you're going to be able to figure out what's the right way to dose it.
And the other thing I would add to that, at some point early on, you need to do Elevate long enough that you start getting the benefits. It won't happen overnight. Just like, like body really needs that 2 months of a foundation. once you have done kind of that saturation dose with the Elevate, then you can intermix and decide what and when and how. But all of that starts by making sure that you have, I don't know, the saturation dose is not the right thing to say, but it takes time to get the benefits that we're talking about. Like you can't take one or two and think
Right,
that
right, right.
in it, right? Like yield the benefits. Once you have taken it and you've done a full cycle, a month or two of Elevate, then you can pepper in whatever, right, here and there, and even do them together. Many people, in fact, both of you guys are successfully doing them together. Well, you guys, I know we could go on and on. We went long, but this is so important. You guys, this may be one of the most powerful products that any of us have ever held in our hands. And the number of people that we can help with this product as we are taking firm hold of this category of emerging science. We've got something really special, and I'm with you all the way, Tina. Like we're blazing new trails, and we will not be forgotten for the ones who blazed the trails, who started the conversation, who just kept educating. And so grateful for this product. Really grateful, Dr. Lynn. Thank you so much. I feel like I learned so much tonight. Tina, thank you so much for being on and sharing your testimonial. Everyone, thank you for tuning in. And Sean, thank you for doing the tech. We appreciate you. Good night, everyone.